For this next exercise, you're going to want to grab 2 towels, and 2 bath towels should work. When you have these towels, we're going to want to roll them up. We're not looking for really big, thick rolls. We're looking for just small enough rolls that you can probably take your hand and grab all the way around it, and your fingers can touch together. So again, not big, just small enough to give a sizable roll. And once we have these rolls, we're going to place one right underneath the neck, and you're going to place the second roll right underneath the belly button where your lower spine is. So we basically have a roll below our lower spine and a roll below our neck. Now, this is great if you feel like that your spine is rounded and you've got rounded forward shoulders. This is a positive way to reestablish the curves of the spine. If you feel like you have an excessive arch in your back, you can explore this without rolls. But either way, play around with both ways and see which one helps out or feels the best. From here, once the rolls are set up, you're going to take a block and place it right between your knees. So hold on to that, and let's make sure the feet are pointed straight. So slightly point your toes inward a little bit so the outer edge of your foot is straight the entire time. And I'm going to put 10 minutes on the clock and start my watch now. From here, your only job throughout the entire exercise is to hold this block between your knees. But it doesn't need to be hard. It just needs to be about 25 to, at the most, 50% of your effort throughout the next 10 minutes. And why don't we widen our arms a little bit so the shoulders feel like they're laying just a little flatter on the ground. The whole goal of this exercise is in the name, the Hip Flexor Conversation. By you holding this block between your knees, you're using your hip flexors, your groin muscles, the inner thigh muscles of your leg, and we're asking both to work together to be able to hold this block. Your only job here outside of holding this block is to also breathe too. These hip flexors attach right onto the inner part of the hip, the femur, and they go across and over our pelvis and hook on to the bottom 5, or for some people, 6 vertebrae in their lower back. The hip flexors also share a really close relationship to the diaphragm, the muscle that helps you breathe in and breathe out. When we get stressed, we arrest our breath and our diaphragm stops being able to be used properly, which also has an immediate and direct impact on how our hip flexors function. So usually if there's anxiety or if there's a lot of tension in the body, the hip flexors also equally get tight too. So what I want you to do is be able to practice breathing here. So allow your breath to come in through your nose and out through your mouth. I want you to have a really nice, slow, rhythmic breathing rate while your hip flexors are working. And I want you to think of each breath as a very gentle, simple attempt to almost kind of separate the diaphragm, the breathing muscle, and how the hip flexors are working. Because they are 2 different muscles. They should be able to work independently from one another. When compensation and dysfunction are around, they kind of both hook onto the same function and they both become increasingly reliant on each other. And that's what we're hoping to change. So for the next 10 minutes, it's literally you just having a conversation with these hip flexors. Now we're about 3 minutes in, so you might notice that one hip starts to feel a little different than the other. If your femur, your thigh bone, if one femur is in a different position than the other femur, which you're going to know if you just take a look at any of your standing posture tests or photos, you're going to see one knee is pointed in a different direction than the other. Or if you have knock knees, where the knees come on the inside of the ankle, or maybe bow-legged, where the knees go wider than the hip and the ankle. If your hip is not able to rest in a neutral position, which is what this is, right? And I say neutral because there's no rotation. The knee's not coming in closer towards the midline of your body. The knees aren't able to go further away. One knee isn't able to point in a different direction than the other. Both femurs are in the same position at the same time. And you're asking both femurs to stay balanced and symmetrical while holding onto a block between your knees. So you're probably going to notice, if this is a challenge for you, that one hip starts to work different than the other. And that's a really strong indication that both femurs are not in the same position at rest. So if you do experience imbalance here, that's okay. There's nothing I want you to then go do. For example, if you feel your right inner hip working tremendously hard just to be in the same position as your left, that doesn't mean the left one's not working, right? Trust that your body's in a balanced position. So if you experience imbalance, that's okay. Just let your physiology do what it needs to do. Trust that your muscles will figure out how to work in a balanced function when the time's right. And that might not be today. It might be in 30, 60, or 90 days from now, of you just practicing this exercise day in and day out until both hips, both femurs, are able to stay in the same position at the same time, and you have full access to both hip flexor muscles. Just a friendly reminder to keep breathing here on this one. Pay attention to if one hand is trying to make a fist. If there is an imbalance with this exercise, the question is not if the upper body has had to help out. The question is how much has the upper body had to help out? So it's not uncommon for somebody to be asking both hip flexors to work and the right side of the neck starts tensing up, because that's what's been trained for days, weeks, months, and years for a hip flexor not being able to function properly. So if we really listen close enough, if you close your eyes and you really tap into, first of all, your breathing being able to happen, you can really start to listen to what else tries to chime in here that has maybe had to chime in or work for both hips not being able to function properly. Check your intensity level. Let's make sure we're hovering right around 25-ish% of your ability to hold in on that block. Over time, you might try to really grip that. Keep it light, keep it easy. Keep this as a gentle, simple conversation. Another great thing that's happening right now, as we are about 7.5 minutes in, is this is 7.5 minutes of you sitting with your breath, 7.5 minutes of your hip flexors being asked to stabilize your hip, pelvis, and spinal position, and 7.5 minutes where your spine is having to conform and fall down to the ground. Basically, it's going to move to the position of the towels it's on. So this is a great way if you have a military neck where you've lost the curvature in your upper neck, or if you have a flat back from sitting a lot. This is a great way to reestablish those proper curves with these rolls. Again, if you have excessive curves, maybe taking these rolls out and allowing that spine to actually settle to the floor is another brilliant way to start getting some great repositional therapy in here. Just shy of about 1.5 minutes left. Let's take a couple more deep breaths in through the nose. Not trying to force a big breath, with whatever depth feels comfortable for you. If you're going to spend hours sitting at a desk hunched over, this is such a great, simple way to reverse hours and hours and hours of work in about 10 minutes by reestablishing that proper curve. 45 seconds left. Make a mental note of how this exercise feels for you and observe how it starts to change for you over time. Because you're spending 10 minutes sitting with one stimulus and one sensation, you can really use this exercise as a tool to understand how your body changes as function is reestablished with how your entire body's moving. That's 10 minutes, so great job with that.